blanket lockdown. 4 weeks of restrictions began at midnight after a majority of MPs backed the government's plan to contain the spread of coronavirus ahead of Christmas.
Some MPs warned that severe restrictions could be disastrous for the economy, and a number of them voted against it. So, will lockdown do more harm than good? Let's talk to Professor Devi Sridhar, who, of course, says lockdown is necessary, also argues it should have come sooner. Professor of Oncology Angus Dalgleish says lockdown is a worse killer than COVID. And intensive care consultant Dr. Indy Kapila, who says the only way to deal with the virus is through restrictions. So, Dr. Indy Kapila, can you, as somebody who is working absolutely at the sharp end of this crisis, what is happening in intensive care units right now?
Thanks very much. I think the current situation is that we are seeing a rise in infections in the community, which is leading to a rise in admissions to hospital and to intensive care units. There's no doubt about that. That's happening across the country. Certainly in the northwest, we're seeing a larger rise compared to other parts of the country. But as a whole, we are seeing a rise in admission rates.
And to put it into context, Dr. Kapila, how is it comparing to the what we saw in March, April?
So I think that the differences between the first wave and the current resurgence is that we had little knowledge about the disease during the first phase. We took very stringent measures to ensure that the NHS didn't get overwhelmed. The lockdown was brought in, and that seemed to be effective. It certainly reduced the rate of infection, the spread of infection. We're now seeing a slightly different approach in the sense that we do have some treatments available, but the big concern is that the spread of infection in the community is difficult to control unless we have some restrictions. The emphasis that the British Medical Association has put on how to reduce the spread of infection is essentially preventative measures, the basic measures, hand hygiene, use of face masks and social distancing. But clearly that hasn't worked, and we're finding that as infection spreads, we have to bring stronger measures in.
OK, let's bring in Professor...
Lockdowns do work.
Yeah, thank you for that. Professor Sridhar, I mean, you're not a pro-lockdown person. I'm not a pro-lockdown person. I don't think anybody is. Nobody wants to do this. The question, open for debate, is whether we have to do this. In your estimation, is this an essential tool right now to get on top of the virus?
Yes, definitely. I think there's been a false debate between lockdown harms versus COVID harms, instead of thinking through actually what would uncontrolled spread of this virus mean, which would mean further economic damage and actually social harm and health services collapsing. And so actually I've been quite frustrated because the reason we're in this lockdown is over the summer, we had voices saying case numbers don't matter. This virus is like flu. It'll magically go away. And actually this has created misinformation, which is dangerous. It's been frustrating to watch. It's like being on an airplane. You know, the engine doesn't work and everyone gives their opinion what should happen instead of trusting the people who have engineering experience and have done that for years. We should be doing this with infectious disease management instead of having a free-for-all now, which is creating...
The numbers are very worrying. Yesterday, nearly 500 new deaths reported, nearly 1,500 people newly admitted to hospital in the last 24 hours. Over, I think, 12,000 people now are in hospital with COVID. These are worrying numbers.
Oh, incredibly worrying going into winter. I mean, I think we are going to see hundreds of deaths, thousands of deaths in the coming weeks, even with the lockdown measures. The thing to remember is it's not a choice between other patients and COVID patients. It's a choice that we want to protect all patients receiving care. And the way to do that is to keep our COVID numbers low. Yeah. We really don't need a functioning test, trace, isolate system, good guidance to the public, and border measures. I mean, if we had these three things, we'd be on our way like East Asia, instead of being stuck in the cycle.
Professor Dalgleish, you're a cancer professor of oncology at St George's Hospital, my local hospital, in fact. Professor Sridhar says it shouldn't be a split between lockdown harms versus COVID harms, but I think that there is a concern that lockdown does cause more harm to a greater group of people. Is that something that you're concerned about?
Yes, of course, it is a major concern. The damage that's been done to cancer management already is just appalling. The number of people who haven't been able to have their screening, if it's suspicious, diagnosis, early treatment, is now in the tens of thousands. And these patients, unlike a lot of COVID deaths, these patients are often young, 20s, 30s, 40s, with cancers that are curable. And I'm just talking about what I see day to day. And I've already witnessed a couple of people, one of whom's died because of the inability to get screened and tested properly, and another who's gone from curable disease, investigation, surgery delayed, now stage 4, is not going to be curable. I would like to see all this actually put in to the into the equation before making judgments about lockdown.
See, I think those people, Professor, those people absolutely have to get their treatment. We've had 6 months since the last lockdown to prepare for this, to make sure they do. But that's, as Professor Sridhar said, it's a slightly different issue to how we deal with COVID-19, which is out there killing huge numbers of people, isn't it? I mean, why can't we do both? And isn't the best way, without an effective test, trace and isolate system, isn't the best way to suppress the virus to have a lockdown?
No, I don't think it is. We had a lockdown before and it clearly didn't work. We're getting a mutation. It is getting more infectious. But at the end of the day, this is not Ebola. This is not killing a majority of people. When you look at the people that this virus is killing, the average age is 82, 83. And yet, because of this, we're actually denying the normal health care. I just mentioned cancer, but my colleagues who have to deal with the cardiac, heart attacks, strokes, and the really big thing of all is the mental health. The suicide risk for people not able to cope is actually doubling. That's official figures I could get hold of. But in the Daily Mail the other day, there were 42 psychiatrists basically said another lockdown is going to lead to the collapse of the entire mental health system in this country.
Well, this is very worrying. And as I've said for a while now, if we have to have a lockdown, and I don't think there's much other choice given the failure of our testing system, we have to make sure that those that have other health issues get the treatment they need. Listen, there's no easy way through this. You're all experts in your field, and we appreciate the work that you do. And thank you for joining us today.